breaking news from NBC4.
Governor Mike DeWine and ODH providing an update this Monday on the coronavirus in Ohio. Let's listen in.
The tie that I'm wearing is a tie that belonged to my friend George Voinovich. His son George sent this to me a couple weeks ago, and it's appropriate, I guess, today. It's just a children's tie that I saw George wear many times. So I'm honored to wear it. I, of course, served as Georgia's lieutenant governor. In addition to that, we served together in the United States Senate. And we miss him a great deal. John Husted is working, as I said, that he would not be here for every one of our 2 o'clock sessions. He is working with our business community and our medical advisors in regard to preparing the rollout for March 1 as we begin the pathway to have more businesses come back online and more people get the opportunity to go back to work. So that's where John is today. We are actually in a different location today. I am, and Dr. Acton is, the Ohio Department of Public Safety, and we thank them for hosting us here today. Let me share a little bit with you. Our Ohio travel and tourism community is helping to provide us with the ability to actually go places, but not really go, but doing that through virtual travel experiences. You can find links to Ohio's many sites and activities at www.ohio.org. Today I wanted to highlight the Belmont County Tourism Council, clear on the eastern side of our state. They have added virtual puzzles to their website using pictures of beautiful locations from across the county. All you do is click on the image to start your virtual puzzle. You can adjust the number of pieces in the puzzle for your skill level, and you can send the puzzles to friends or family to see who can complete the puzzle first. This is a great intergenerational project. Kids, grandparents, grandkids, people who cannot gather in person. The Belmont County virtual puzzles can be found at visitbelmontcounty.com. That's visitbelmontcounty.com or on ohio.org. Oh, that's pretty cool. I want to talk this afternoon about our schools. And I know this has been something that teachers, parents, everyone is very much interested in. And I have talked in the last few weeks with a number of parents, with a number of teachers, with a number of administrators about this. I've also talked to our Ohio Superintendent of Public Instruction, Paulo, who does such a absolutely great job. He and I have consulted about this. I've also talked with legislators about this. And so let me announce that for the remainder of this school year, our young people will continue to go to school remotely. I want to thank the teachers. I want to thank custodians, all school personnel who just make a difference every single day. The bus drivers, those who work in the lunchroom, everybody, that family, that really is a family in each school district, in each school building. I want to thank them for the great job that they have been doing. Thank the teachers. I want to thank the parents as well, because I know the parents have been very much involved in this education as it goes forward. Let me explain the reasons for the decision. First, the virus continues. We have flattened the curve, but it remains dangerous. The situation is fluid. We now have 8 or 9 days straight of a fairly straight line in regard to hospitalizations So that's good news. We'll feel a lot better when it starts going down. But this situation is still very tough. Second, one of the things that have been expressed to me by teachers as well as superintendents is continuity. And to go back to school now with a relatively small amount of time left by a large number of superintendents, principals, others who've expressed to me that probably is not a good idea, even if the health situation was resolved, which obviously it is not. Not only do we have to be concerned about the risk to students, but also obviously teachers, and ultimately the risk to the community with a number of kids from a number of families coming together and then going home. We know that statistically that unless a child has a specific medical problem, the fatality rate is exceedingly low among young people. But we also know that young people are carriers. And the reason that the schools were shut before, the physical locations of the school, was because of our concern about people coming in, kids going in, then going back and forth, back into their families, and the spread that occurs because of that. So that issue continues to remain. So those are the reasons that we have made the decision that our young people, K through 12, will continue to go to school as they are remotely and will not go back in the physical building this academic year. Now, as we move forward, because I know that's what, if I was a parent, grandparent, I'd want to know. We've made no decision about the fall yet. We're going to have to see where we're going. I know that parents, teachers, administrators are anxious for a decision about the fall, but we are simply not in a position yet to make that decision. I am happy to say, though, that schools are, in fact, already preparing for the fall. They're thinking about how they would handle the situation if they were back in school, how they would try to do what they could in regard to social distancing and to run the school as well. So I applaud them for that. Many conference calls I had, several this weekend. I was just really impressed and delighted by all the thinking that's going into this already. As our teachers are looking at this, and our administrators are looking at this, and school board members are looking at this. So I would encourage you to continue to plan. We will work very closely with you through the Ohio Department of Education, and I know that contact is going on every week, and so that will continue. And as we know more information, and as we can share information from experts about the social distancing, we're going to make. So we appreciate the planning that's going on, and I would encourage schools to continue to do that planning. One option that was discussed with me by a number of superintendents and teachers was the possibility, and there's no decision about this obviously, but the possibility of having a blended system this fall. A blended system that might mean some distance learning as well as some in-person learning. Now, that's just a possibility, and also each school district is going to be different. And a school district's ability to successfully do the distance learning, I fully understand, is different from school district to school district, and from population to population and families to families. One of the things that I think is very strong about our Ohio school system is it's local. And so as these decisions are made, we're going to allow a great deal of flexibility, as we should, for the local schools, because what they find in their district and how their district looks is very different. Akron City Schools are different than the Switzerland School District, and I could go on, example after example. And so these are things that each school district, we're going to give a great deal of flexibility within some broad parameters to ensure safety of young people. Let me share with you, as residents of Ohio, whether you have kids or grandkids or don't have any kids, or anybody in school anymore. Let me share some of the concerns that I have as we go forward. Safety of the children, safety of families, safety of parents, safety of teachers, obviously, is very, very important. We've talked about that. But as I talk to teachers, and as I talk to superintendents, as I talk to parents, I just want to mention different groups of kids who I have particular concerns about when they are not able to be in school the way that we normally have that, and that is physically to be in school. And I want to say before I list some of the kids that I worry about, people are doing an amazing job. Our teachers are doing an amazing job. I mean, everybody has just stepped up and is doing things that they never would have thought they would have had to have done, but they're making the best of a very, very difficult situation. And I'm just impressed every time I talk to teachers, every time I talk to superintendents, of the thought that is going into this and the planning and what teachers are doing now and what parents are doing now and administrators are doing now to bring the best education they can to these kids, to our kids across the state under very difficult and certainly unusual circumstances. But let me, as we plan to the future, let me talk about students that I am particularly worried about, and this is not based on things that I dreamt up. It's based upon what educators are telling me, parents are telling me, teachers are telling me. One, children with special developmental needs. As we go forward, whatever we do in the fall, what we do in the summer, I think that we have to remember these students. Second, children who have health challenges. As we look to go back in the fall, if that's what we end up doing, we have got to figure out how to protect children who have unique health challenges that may make them more susceptible to COVID-19. Not more susceptible to getting it, but the consequences of getting it may be more severe. And so I think we have to think about these kids and figure out how we're going to help them, how we're going to protect them. Three, children with no or limited access to the internet. We find these children sometimes in our cities, we find them sometimes in our rural areas, and it is a challenge. We have over 1 million people in the state of Ohio adults and families, who don't have good internet access or no internet access at all. So that remains a challenge. I worry about children who do not have a supportive home life. That is always difficult for kids. It is particularly more difficult when kids are not physically in school every single day. And so again, these 4 groups of children, and there may be many more, but these are the ones that I think that we, as we plan ahead and we try to think how are we going to have school, educate our kids with a virus that is still out there. I think these are some kids that we need to be particularly concerned about. Let me move now to another area of concern, and that is the disproportionate impact that the COVID-19 virus is having on our African American community. I asked the health department to give me the latest data and the breakout. And as I read these numbers, one of the things that we have pointed out before, Dr. Acton has pointed out before, is that our statistics
Clearly, we're having some technical problems coming out of the governor's news conference today, talking about the updated numbers and where we stand on the coronavirus here in Ohio. But of course, the big headline to come out of this 20 minutes or 15 minutes into this news conference is that the school year as we know it here in the state of Ohio for kids, it's over. You're no longer going into that building. You will be spending the rest of the year learning remotely at home. K
through 12 is going to be staying in remote learning, and obviously what they're doing is trying to talk about where they are in the fall. Do we have the signal back?
Not yet. So he said one of the big things that he is concerned about is, of course, the spread of the virus. Three of the things that went into making this decision. The small amount of time that's left for kids to be in school, because I mean here in Central Ohio most kids get out before the Memorial Day weekend. Right. And then the other thing he said, the risk of course to the coronavirus to not only the students but the educators, the teachers, the staff there, and he just doesn't want to do that when you've got so many people coming in from all over the place.
I don't think this surprises a whole lot of anybody. No. Certainly nobody in the school situation. People didn't think that it was physically possible for them to get back into the buildings, start something, figure out physical distancing, and still continuing to do this and create a situation where, okay, now we've wrapped it up inside. I think they've spent so much time in remote programs now of getting education ready, that getting it done right now this way is the best way to do it. But the bigger question is, can we do it again in the fall? And he listed
and that's what he's talking about, that he has been educators, the administrators, teachers, principals, and the Ohio Department of Education. They've been meeting frequently, he said basically weekly, talking about what this could look like when and if the school doors open come September here in Central Ohio or across the state. And some of the things he said they're looking at it, of course, is they're concerned about the kids with developmental needs.
And then if you have special health needs because of this virus, how many fit into that category of having special health needs that should they contract this virus? How
much worse is it going to be for them?
And can you actually go to a school because of what you're now dealing with?
Yeah, and then the other thing he said he talked about is that how important it is to keep in mind the people, the 1 million Ohioans, adults and their children, that don't have access to good internet service. They just don't have that. And then he, of course, talked about the kids who don't have a good supportive home life. So he's going to be thinking about all of that as they prepare and try to get ready for fall.
We have another 1,317 cases listed today. That may make people go, my goodness, we're continuing to hit a different situation. But we're dealing with more than 1,800 in the Marion prison system. We're now gathering information. But with that, only 38 more deaths since yesterday, and now hospitalizations only at 2653, with 798 in ICU. I think if you follow the hospitalization numbers, which have not jumped very much.
And he said for the past 8 or 9 days, they're fair, not good, but they are fair. And the other thing that he wanted to talk about, he was getting ready to talk about when we lost that signal, the racial disparity that's going on here with COVID. Let's toss it on out to Adrian Robbins, who is there with the governor to kind of recap what's going on inside and what's going on to try to fix the technical problem that's going on. Adrian.
Well, Brad and Darlene, obviously we are seeing some technical issues. They are coming at the same time where the governor has changed the place where he's holding these news conferences. So we're just waiting to hear more. But obviously there is a lot to already unpack with what the governor was talking about. It's an announcement that I think many parents and teachers and students knew could be coming, but it hadn't come yet. But yes, students will no longer be going back to their K through 12 buildings for at least the rest of this year. The governor said the fact is the virus is still. And guys, we're hearing now that the governor is actually back up, so let's go ahead and take a listen on what he's saying now.
I apologize for that. I was talking for a while, so I'm going to go back because I suspect that this part you missed, and it's very important. We have a disproportionate impact of the COVID-19 virus on African Americans in the state of Ohio. That's true across the country as well, but it is very, very concerning. And let me just share with you some data. Right before I came in here, I asked the Department of Health, excuse me, the Department of Health to give me the current numbers as breakdown of COVID-19 cases in regard to race. White was 49%, African American 21%, Asian 1%, biracial 7%, other listed as other 10%, and unknown 11%. So you can tell this data is not really complete, but you can also tell that with African Americans at 21% listed out of this group, that the number is certainly higher than 21%. But even if it's only 21%, that certainly is disproportionate to the African American population in the state of Ohio, which is somewhere between 13 and 14%. So this is very, very concerning. We have put together a group to take a look at this, and it is a group. I'll pull the list out here. It is. This list will be available to the news media, and it'll be up on our webpage. But this is a list of people who are going to serve on a working group. Minority Health Strike Force is what we are calling it. And it's a group of individuals from throughout the state of Ohio who are going to focus on this and see, what are the things that we should be doing, what are the things that can be done in the community. I've asked my Director of Aging, Ursel McElroy, who is on this task force, along with Alicia Nelson. They both from my office. But I've asked the Director of Aging, Ursel, to be on the Skype. Ursel, there you are. Hello.
Hi, Governor.
Director, you want to talk a little bit about how you see this task force, this minority task force, and how you think it's going to work, and maybe kind of what some of the goals are?
Absolutely. So happy to join you and to highlight the very important issue, access to high-quality care for all Ohioans without COVID-19 and those who contract the illness. As you noted, there has been heightened recognition across the country of the early indications that communities of color, in particular the African American and Hispanic community, have been disproportionately affected by COVID-19 and the illness it causes. So it is incumbent upon us as we respond to this crisis as a state.
I think the problem now is, as Adrienne was pointing out as we went back to the governor, this is now a different spot instead of the State House. This now at the Office of Public Safety that he is holding this press conference.
And it seems as if he can hear, the governor and people in the room with him can hear, but we cannot hear for broadcast.
Yes, so we're trying to jump in. This is Ursel McElroy, who is the Director of Aging out of the governor's office. She is going to be on, if not heading up, what he calls the Minority Health Strike Force, as he is dealing with the disparity of the coronavirus and what we are seeing it in the community. Some of the numbers that he put out, that 49%, as you can hear the music in the background, I'm assuming they're trying to fix the audio within there, 49% white, African American 21%, Asian 1%, biracial 7%, and other another 11%.
And it was interesting how he talked about that 21% of the cases affecting African Americans when here in the state of Ohio, 11 million people, he said, where blacks make up only 13 or 14% of the population here. So that is a huge number, huge disparity there.
So this strike force, he says, is something that he is pushing and is going to make an importance for him both in this fight against the virus and something that he is working with in his office. So I'm not sure whether the word yet has gotten to him that we can't hear Ursel. Hopefully the audio comes back on the governor,
about
which
testing.
we're getting now.
A while ago, Director Acton issued an order for our hospitals not to take their testing to the private sector, LabCorp or Quest. And the reason we did that was not because we had any doubts about their ability to test or the quality of the testing, but the backlog was very disconcerting, and it was not providing Ohioans with the results very, very quickly. So they had quite a backlog, 5, 6, 7 days. That backlog has now been cleared up, and so we want to make testing available, and again, to broaden the testing. And so going forward, LabCorp and Quest are now, hospitals can take their tests there. They can have them do the test. We will monitor the turnaround time. If the turnaround time becomes bad again, we will stop using them. Because it's very important to get these results just as quickly as we can. But this gives us a broader ability to test, and so we welcome them back, and we message to our hospitals today, if that's where you want to take them, you certainly can take them, and just as long as we're getting the results back quickly. I want to talk a little bit about reporting of information and data. When I became governor, one of my goals was to have more information available for decision makers, legislature, executive branch, more information available to the public. I can tell you that as Attorney General, for 8 years going through and trying to look at data in regard to the drug epidemic, I was often frustrated by a lack of timely information that was coming to us. And so we have started down the path. We started down the path over a year ago to increase the amount of information. It's a path. We've accomplished some things, but we certainly have a ways to go. It is really imperative in this particular crisis that we balance the public's right to know and our obligation to protect Ohioans' health privacy rights. We have to balance both of those. So far, as part of our commitment to transparency, the Department of Health has developed several data dashboards to reflect data from multiple sources, including the Ohio Disease Reporting System, hospitals, local health departments. Much of this data is updated on a daily basis, and it's also available for downloading so that anyone, any Ohio citizen, can perform their own analysis of the data. This is the broadest and at the same time most granular level of information the department has ever made available before on infectious diseases, and it is updated on a daily basis. The data we currently share on the coronavirus is at coronavirus.ohio.gov. On that particular website that you're now all familiar with, it includes the following: an overview of the coronavirus cases, hospitalizations, and deaths by county and by the day symptoms first occurred. This data is updated daily. Next, we provide a breakdown of positive cases confirmed by laboratory testing and positive cases as defined by the CDC's new expanded definition of positive cases that relies on a clinical diagnosis. And again, we separate those out so you can tell what it would have been under the old counting system, what it is under the new counting system, and people can take that and do whatever they want with that information. The Department of Health breaks down cases by age and by gender. Again, many of these things you see every day with Dr. Acton. The daily cumulative case count and deaths are broken down by new daily cases and existing cases. The Ohio Department of Health displays current trends of cases, deaths, and hospitalizations, including reports received in the past 24 hours compared to the 5-day rolling average. Ohio Department of Health provides the age range and median age of cases, hospitalizations, and deaths. Ohio Department of Health also provides a cumulative number of intensive care unit admissions, updated on a daily basis, as well as the ICU admission percentage of total cases. Further, they have tracked the number of counties with at least one case, hospitalization, or death. The Department of Health tracks and provides the number of lab tests performed. The Ohio Department of Health provides the number and percentage of cases impacting healthcare workers. And on an aggregate level, ODY provides the race of individuals, hospitalizations, and deaths as they are reported to the department. ODH provides forecast modeling of predicted cases, and ODH provides cases and tests completed for residents and staff of state-owned facilities, such as youth service cases, and testing completed for residents of state-owned facilities, such as prisons, youth detention centers, psychiatric hospitals, and developmental centers. This is certainly more information than the Department of Public Health has ever put out before. But it is a work in progress, and we're going to continue to try to broaden that, not just with the Department of Health, but in every other agency in the state. At the same time, we are charged by law with weighing personal privacy rights, weighing personal privacy rights of the individual citizens here in Ohio. In Ohio, the law specifically sets apart protected health information in Revised Code Section 3701.17A2. Ohio law allows us to give aggregated data, and that is the type of information that I just talked about. We cannot release data under Ohio law. That's what it provides. That is so specific that the data or data combined with other public data can then lead to a person's identity. So we have to strike a careful balance. The Ohio Supreme Court has recognized that protected health information under the Ohio Revised Code is an exception to the public records law. They did this in a case called Cuyahoga County Board of Health versus Lipson O'Shea Legal Group. However, as I said before, we are balancing our obligation to protect privacy with our desire to be as transparent as the law allows us to do it. Now, last week, we published information about positive cases in long-term care facilities in Ohio, including nursing homes. We found that there was inconsistent information, inconsistent reporting, and causing inaccurate data. We took that down. I've asked the Department of Health to fix that. They are in the process of doing that. They've been making calls and doing the due diligence. So we took the inaccurate data down. It is being corrected. And we'll be posting updated data Wednesday at 2 p.m. Wednesday at 2 p.m. And that is when that data will be updated every week. Further, I have directed the Department of Health to collect more specific information regarding nursing homes. This data will include COVID-19 cases broken down in each nursing home category by residents and staff. So we will report in each nursing home the number of residents, if any, who have COVID-19. We'll do the same thing for the number of staff. And when we report that information, we will report what is new since the last report and what the cumulative numbers are. So the cumulative numbers are just that, cumulative numbers. If someone has left the nursing home, if someone has died, those numbers will remain accountable to that nursing home or listed by that particular nursing home. But then people will be able to see the new cases that have just arisen in that last reporting period. So we'll also break it down, as I said, by facility and by county. So we're going to do that by nursing home, and we're also going to do that by assisted living facility. Again, the number of staff, number of residents who are COVID-19. This will be reported every Wednesday, will be updated every Wednesday. In addition to this, while balancing transparency and individual privacy rights, we will report aggregate death data for nursing homes and assisted living facilities at the county level. We will do this at the county level. The reporting module will need to be modified to accurately collect this information. So I expect the reporting on deaths at long-term care facilities by county will not begin this week, but should begin next week. Finally, I know that Ohioans are concerned about how COVID is impacting our healthcare facilities, particularly our hospitals. So let me talk about our hospitals. Our current data collection tool has limitations. Therefore, I have directed the Ohio Department of Health to modify the Ohio Disease Reporting System to accurately collect case information for individuals who are direct care providers at hospitals, including the name of the hospital where they work. I expect this data to be available very soon. So, to put in plain English, you'll be able to see by hospital the number of their healthcare staff that, if any, have come down with COVID-19. We will begin reporting how many healthcare workers at each hospital are positive for COVID-19, and that will be up, we hope, by next week, just as soon as we can make the changes that need to be made in the reporting mechanism. Dr. Acton.
Well, thank you, Governor. Hi, everyone. Good afternoon. I don't think I could have given that much detail on data any better than that. I do think it's very important, as we always do talk about data, is to try to remember that it has to be taken in context. And I think we're all very alarmed, and it's very painful to see that congregate settings, such as nursing homes, are particularly at risk during this COVID-19 pandemic. And anytime that folks are in close proximity like that, that is going to be an issue. And I know we've seen some pretty startling stories. There are some bad actors out there. And one of the things that was in our order originally that the governor wasn't mentioning as he talked about data as part of my original order was to mandate that the facilities tell the families when there is a case, either with their workers or with someone who lives there, because this is, again, someone's home. And I think that's very vitally important because we are going to see folks get sick in nursing homes. We'll see some folks die. And that doesn't necessarily mean that they're getting bad care. They might be getting the best of care. And so it's really important for all facilities and all families to keep that dialogue open. What is not acceptable is for folks to be left unawares. And so I think a very important part of our order was mandating that within 24 hours that communication be taking place, because we do have the right to know what is happening with our loved ones. So I just wanted to add that caveat in there. So starting with our data today, we do now have 12,919 cases. Of course, we've gone over a weekend, and we have 2,653 hospitalizations. And now on record, we have 509 deaths in the state of Ohio from COVID-19. Next slide. While most things are staying pretty steady in terms of our percentages because we're still testing at about the same level, I think one thing we need to take into consideration as we look at our data is that we did go into prisons and do some intensive testing, as was mentioned last week. What was fascinating about some of that data is the amount of asymptomatic cases we are picking up. I talked to my colleagues in all our neighboring states, and they are seeing a similar trend when they go into a facility and do widespread testing in a high-risk situation, they pick up extraordinary amounts of asymptomatic cases, in one institution up to 70%. And we're starting to see that in the literature. So that wasn't new, whether it's a nursing home or a prison. Now, those asymptomatic cases might be someone who's not yet showing symptoms, and those are numbers, sir, that we don't really know yet. And then, as we know, there is a significant amount of the population who are really being carriers or vectors without even realizing it. So this is the game of this virus. The threat of it is that spread. All of this is about how much we're spreading and putting others at risk, maybe while not knowing it. All again, reinforcing for us the absolute essential basics that we are doing that are really saving lives. What I do is saving your life, what you do is saving my life, and people a few steps removed from us. Other interesting data we found is that there's a significant amount of morbidity and some interesting indicators in younger age groups around things like obesity and other effects on the body that aren't necessarily, we've been thinking this as a lung disease, but it's really having impacts on different parts of our bodies and at different ages. So there's just a lot we're still learning about this novel virus. So I want to say that don't be surprised as we learn day by day some things new. That hasn't gone away. This virus remains predictably unpredictable. Next slide. So looking at our trend data with that in mind, we are seeing some upticks. And as that testing is expanded and we're going into high-risk areas, we still have very little testing. So we continue to try to target our testing at the highest risk groups. And by going into a facility and being able to spread that, as we're going to be doing, and we're looking at plans for doing that more extensively within nursing homes, we shouldn't be surprised that we're going to see some upticks. The more we test, the more cases we're going to be seeing. Likewise, as we make any moves on taking up or opening up, we should be expecting that with every slight opening we do, we will be seeing some increasing spread. But right now, we really are looking at a trend where we're still at that peak level that is a flat plateau, and we are not decreasing. Next slide. So I brought back an oldie but goodie for us today to start to think about our future. We know that we are going to have to learn with this virus. We've talked about the fact that there is no putting the genie back in the bottle. Whether we have orders or not orders, whatever we do, the virus is spreading amongst us. Even the best estimates are thinking, and nobody has exact prevalence yet, and so we can't say for sure, but it could be anywhere from 5 to 15% of our population that has been affected. Until we're able to test more widely, we won't know that answer. But the virus is still out there, and it's disrupting everything from who gets sick to completely disrupting supply chains around the world. So we have to go back to the fact that this is, what is the year ahead? There's a fascinating article, it was in the New York Times this weekend. Donald McNeil, front page of the New York Times. It was an extensive look, talking to economists and epidemiologists and doctors and just a wide variety of fields, historians, to say, what is our new life going to be? Because I think a lot of us are really longing to understand a little more of the road ahead. And while we'll be talking more about this in the week to come, I thought it was interesting to go even back to our Philadelphia governor in St. Louis. And so it really was, when you go back and look at St. Louis, we focused very much on the peak, the curve that was most dangerous around hospital capacity overload. And we remember that Philadelphia spiked so much so that it ended up dealing with some of the things that we're looking at in New York City right now, where we really, are concerned about having enough providers, where there's now evidence that ambulances were not able to get as quickly to people at home having a heart attack or a stroke. So it's not just about how many beds we have in hospitals, it's about how our whole system can help all of us. But in St. Louis, they actually, this is over a long period of time, and St. Louis actually had, and as what we'll see in our whole country now, is we're trying to avoid those big peaks, but we're going to have a series of bumps. And these bumps will happen. They'll happen no matter what. If there's an outbreak in a given facility, we'll see a little bump like we're seeing this week. And as we alter the amount of people who are moving about in the population, we'll see bumps. But the most important thing is how we respond to those. And we're calling those more and more hotspots, flare-ups, fires. And what my job and my team is working so hard on is what is our ability to put out those fires immediately when they happen. And that's the testing, the contact tracing. And so we're working tirelessly, sir, on testing ability and using the testing we have well, but we're also working on building a complete army of people who can contact trace. Because we know in a year ahead, we will not stay flat. Even if we go down, and when we go down, we will see a journey of bumps. And so even in St. Louis, look at this. They did these amazing things and they slowed it down. But they actually had a period, sir, where they removed mass gatherings and schools all at once. So people were longing to get back to life the way we're all longing right now. And so in St. Louis, they did that. They removed a bunch of the social distancing all at once. And usually with these things, when you remove them, it takes 3 to 4 weeks to see the effect of it, because it takes a while for this virus to incubate and start spreading and infecting each other. And when they did that, they saw a big spike here. Now, it wasn't a spike that was the original spike, but it was enough so that St. Louis had to dial back. They had to dial back and put back in place the mass gatherings and the school closures. So I think what we're seeing here, not just us in Ohio, but all over the country and all over the world, is trying to learn from history, trying to learn from the data that we have as we have it, and go slow to go fast. We need to go slow to go fast, because when things go too fast and you see things respond too quickly, people in their panic are going to have to go back. You have to go backwards. You have to dial back. So I think what you see every state, and all my colleagues as well, and all the scientists around the world, is figuring out how you slowly go back in a way that when those hot spots occur, you can put them out immediately and not have to dial back. So, you know, it's a road ahead of that. We're building those structures. We're doing it in every sector. Every sector, the governor just mentions schools remaining closed, but they're not closed. They're still working through the end of the year. But we're all working behind the scenes. In schools, we're working on new ways to do schools. In businesses, we're looking at new ways to make businesses safer. We're looking at new ways of doing more distance working. And what I think, as we learn to accept, and it's a slow acceptance, the reality of our situation, that is where, and I know this is a deep breath we all must take. Once we sort of accept that we have this journey ahead, and that's why the article was so fascinating, what could possibly the year ahead look like? Once we do that and kind of deal with our grief and disappointment of not a quick fix, that's actually the foreground by which we start to get good again. We start to be innovative again. We start to help our neighbors again. We start to think of new ways to do things. So as much as we start to open up some things, we'll also be innovating again. But it does rest a little bit in us to kind of see that it is a new road. And that is part of the journey that we'll be traveling together. Thank you.
Acton, thank you very much. We'll take questions.
Good afternoon, Governor. Jim Oddie from WHIO
Rush to get to the
TV.
microphone, and Jim Oddie wins again. So,
Thanks for doing this, Governor. Happy Monday. Looking ahead, what's your vision for the end of the school year? Kids will not be returning to the physical classroom, but what about all those traditional end-of-the-year activities? I'll go down the short list. Graduation, banquets, other special recognition events, band camp, everything that follows in the next 6 months. Will those be the same? Will those be canceled? What's your view?
well, you know, this is part of the sadness about all of this. I mean, I know with our children and our grandchildren, end of school year particularly for seniors, is particularly important. The prom, sporting events, so many different things, recognitions, and so, we're not telling the schools how to do this, but again, the gathering of significant number of people is a dangerous situation. And so just as schools have been innovative in regard to how to teach from a distance, I know that they're going to be innovative as they look at how they try to in some way honor the students and in some way compensate students for what they are missing. But it certainly is not going to be easy, and it is it's a real shame. I just I can't express how sorry I am about that. I know how much many of these activities, all of these activities, mean to young people. I mean, an athlete, this is his or her senior year, and to miss the spring sports. And you could go on and on, the Honor Society, et cetera. So these are difficult times, and you're right, Jim. This is something that is going to mean a lot, and that kids are going to be missing. And I hope schools try to figure out, how to do this, but also protect the kids and protect their families.
Thank you, Governor.
Good afternoon, Governor. It's Laura Bischoff, Dayton Daily News. A lot of those kids who are graduating seniors from high school are heading off to college campuses in mid-August. What's it going to look like for them when they get to college? Are they going to be able to pack into dorms and go to big events? And is that chemistry lecture going to have 300 students packed into a lecture hall?
I don't think we know that, Laura, yet. I don't have a crystal ball. I don't know where exactly we're going to be then. So I think it's premature to really speculate. I just don't know.
All right, thank you.
Good afternoon, Governor. Randy Ludlow at the Columbus Dispatch. Prison cases continue to spiral. Over 200 more today out of Marion County, which I'm pretty sure come from the prison. Nearly 800 more cases out of Pickaway County, which would appear to come from Pickaway Correctional. With these kind of numbers, how is the state ensuring the health of those who are ill with COVID-19?
Randy, question that we try to deal with every day. We do deal with every day. Every morning I'm talking to the director of prisons. Every evening I'm talking to the director of prisons. She's put a number of teams together that are working on this. The reason that you're seeing the numbers spike, of course, is because we are massively testing now. And this is something that we're doing. We're going to be doing in regard to prisoners. We're going to be doing in regard to the personnel, the folks who work there. Prisons, by their nature, congregate living. Anytime you have congregate living, whether it's a nursing home, whether it's a prison, whatever it is, once COVID-19 gets inside the gate, inside the door, it spreads, and it spreads very, very significantly. So we're doing a lot of different things. The National Guard is in the process of building out to create some more space for the director. We're looking at additional prisoners to potentially release, all the while have to balance the public safety, but we need to create more space. As we announced Friday, I believe, we are on a rolling basis, so anytime anybody gets within 90 days, they're going to get out in 90 days, then we're going to take a hard look at them and see if they can get out now under the emergency provision that the legislature set up a number of years ago. Our prison population, we expect it to continue to go down, but even beyond the 90, I asked my director, I asked some of our team today to take another look. Do we have other prisoners in there who would not pose a danger to the public, who might be older, who might be more at risk? And we're looking very carefully at seeing who we could let out and can let out. We do not intend to have a wholesale, just everybody in a certain category comes out. What we're doing is trying to do this very thoughtfully. At the same time, we're doing everything we can to protect the prisoners and the employees who are there. But prisons present, as Dr. Acton has said, a very difficult situation. And I can tell you that the prisons, the nursing homes, any place where we have Ohioans gathered together in close quarters, we are very, very concerned about them, and we're working on this every single day.
Thank you.
Jim Province with the Toledo Blade, and this is a follow-up to what Randy was talking about. What assurances can you provide to the public as these inmates are leaving prison, either because their sentences are expiring or because you've taken steps to release them early? How can you protect the public?
Well, I think your question is protecting as far as a medical situation?
Yes. What precautions are being taken?
They are being, my understanding, with discussion with the director, they are being tested. They have every right to leave if their prison sentence has expired, and we have no way of holding them. But testing them on the early release ones, trying to figure out where is a place for them to go? Where can we protect the public? These are all considerations, and they're made on a case-by-case basis. So it's not a question of opening the door and letting people go out. The director is on each case that's being worked on by that individual in that individual case.
And would they be expected to quarantine themselves for 14 days?
Yeah, certainly some of them, that's their condition.
Thank you.
Hello, Governor. Kevin Landers with WBNS 10 TV. Businesses looking to reopen are concerned about consumer confidence. What will your reopening plan include to ensure that people who go into a restaurant, for example, can be ensured that this place is a safe place to eat? And would mandatory masks and gloves, do you think, be required for all food handlers? Thank you.
Well, I don't want to prejudge it, but the odds are yes, as far as what, the mask and gloves. I think that question recognizes what the challenge is. That the challenge is not just, is there a state order that says you can't do something, and we take off that state order. That does not necessarily mean that retail business is going to be flooded with people or get back to normal. So part of the reason we're doing it so carefully is, number one, to protect the public. That's the most important thing. But second, when a business is reopening, if we expect anybody to go there, there's got to be some sense of safety. And so what we are working on, what Lieutenant Governor is working on right now, and working on with our business advisory group, and working on with the different industries and different retail establishments, is to make sure that when the order to reopen takes place and the company can reopen, or the retail business can reopen, that there's an assurance to people that it's been made as safe as it can be made. Nothing is perfect. We can't guarantee anything, but we want people to have confidence. So when they go to a restaurant or wherever they go, that there is going to be the spacing, that there is going to be all the protections that we have the ability, society, I don't mean we, but society has the ability to put in place. If we do that, then the consumer confidence will go up. If we fail to do that and are inconsistent in doing that, then people are not going to have that confidence. So your point is very, very well taken, I think.
Thank you.
Adrienne Robbins from NBC4, and my question's for the governor. As we move forward with people possibly heading back to work soon, you announced that schools are closing. Many parents are wondering if they're going to have childcare for their kids now that they're not going back to school and they could be going back to work. Have you thought about this, and are you thinking about possibly prioritizing daycares reopening with this Reopen Ohio plan?
We have not reached that yet. You know, the same reason that we didn't want schools meeting in person is the same reason that you have in regard to daycare. And that is, you have a number of kids together, and you then have them going back to their respective homes, which is a perfect recipe for spread. That's true with whether it's the flu or whatever, it's COVID-19. But because this is so deadly, you know, that was the concern. Now, what we did, as you know, in regard to certain occupations that were so essential to the public safety, we said that the children of those individuals could be in daycare, but we imposed some pretty stringent, very stringent actually, regulations on how many children could be allowed per classroom and a number of other things. So we don't, at this time, you know, as we said, schools will continue to be remote. We are not ready yet to open up any daycare facilities.
Thank you.
Good afternoon, Governor. Ben Schwartz with WCPO in Cincinnati. I know just a couple questions back you touched on like food workers wearing masks, but I want to ask if there's been any type of conversation about, once we do begin to reopen, just making everyone wear face masks, just if they go outside or step into a business or something like that.
Discussion really about making people do that, but I would just say that it makes eminent sense. You know, we're starting to go back. We'll start around May 1, get people back to work. More people are going to be out going to and from work. It just makes sense that anybody who is out in public to wear a mask. It is more for the protection of everybody else than it is for you, but if everyone's doing it, then it's reciprocal. And, you know, that plus the social distancing are two very solid things, not one or the other, but both, that really will make a difference. And so I know that culturally this is not something we have done. We're not used to going out in public and wearing masks. I certainly was not used to doing that, but I think it is clearly the right thing to do. And as we go back and try to get people back to work, everybody's going to have to do some things that maybe we had not done before. That's social distancing, the mask. These are all very, very positive things. And so I would encourage, highly recommend everyone who does actually go out into public to wear a mask. It can become a fashion statement. It can become, you know, I've noticed in this group here with the reporters, everybody's got kind of a different one, and sometimes we have different colors and all kinds of things. So, you know, we can have at least a little fun with this. But it's been, I think there's no doubt it's the right thing to do.
Thank you, Governor.
Good afternoon. This is Jackie Borchert from the Cincinnati Enquirer. Late last week, Harvard University researchers estimated that we need to have about 152 tests per 100,000 people. Ohio at that point was at 22 out of 100,000 people. How confident are you that we're going to be able to ramp up our testing in the next few weeks, ahead of May 1st, around May 1st? And what is the state doing now to reach that point?
Dr. Acton's getting bored over here. I'm going to let her answer a question. I'll start. You know, one of our challenges I expressed over the weekend when I was on TV has to do with the reagents. And I look at a chart every day that has our labs in Ohio, not just the public labs, but our university labs, our hospital labs. and I look at their capacity, and then I look at how many they're actually running. And one of the reasons that the number that they're actually running is much lower than their full capacity is because they do not have the reagents. And so over the weekend, I expressed a concern about that. There are companies that are trying to develop new reagents, kind of new recipes for the reagent, and some of those have their application pending with the FDA. And so I encourage the FDA to, do everything they can to speed up that process. After I talked about this on TV on Sunday on Meet the Press, I got a call from the FDA. They told me they were working on it. I know there was the particular company involved, I was told, made an amendment or provide additional information on Friday. So the more companies that we can get out there that are providing reagent so that the supply chain of reagent the hospitals don't have to worry about that supply chain, and that they know that they can run an unlimited number, or at least they can run up to capacity. That's going to make a big difference. So that's one. We're doing some self-help in Ohio State, and the health department are working very, very hard to come together, and what they're doing is they're creating more of the swabs and more of the liquid that goes along with that, and they're getting those out every week to hospitals around the state of Ohio. So a lot of good things are going on, but we're not there yet, and we got a ways to go. Dr. Acton.
Yeah, thank you, sir. So our governor is endlessly asking the question you ask, and we spent a good part of this weekend in discussions because we are looking to see if there's anything else we could do that is in our control to expand testing. And we have pushed everywhere. We're not the only ones that have these questions. Every state health officer in every state surrounding Ohio last night in a late night call with me faces the same wall. And one thing we did today was we were saying directly send to our labs. Don't use LabCorp before because they were very, very behind, but they've caught up, they tell us. So we've loosened that our hospitals can send directly to LabCorp and Quest and the other private labs now. And we're going to closely monitor that to make sure that those times are not getting so far behind that we feel it's not helpful to us. Another thing we looked at over the weekend was our tiers. We actually have 3 tiers of sort of how to use scarce resources and who you should test. And we're really looking at that to see if we can tweak it. Could we get any more people under the roof of the scarce testing we have? But another strategy we have, we're also looking at we're creating strike teams and the ability to sort of go into places, get that test and run it back to our labs because we don't want any delays in how someone swabs someone. We have invented swabs in the state, and we are sharing that technology with sister states so that they could do the same. And then we're looking at, say you have an outbreak somewhere, so let's just use the Marion or a prison for an example. If one hospital lab or my lab only can do so many tests that day, how can we make sure to take all those swabs to a bunch of different labs and share across the state so that we maximally test people? So that is part of our sort of zone and regional preparedness structure that we've been building so that hospitals and labs are working together all over the state. So if there is this flare-up in one place where we just have to get those test results, but a lab only has so much reagent in that neighborhood, then can we move that test to a different neighborhood or a different community where they can run it? So it is that kind of flexibility that we're trying to build in to maximize, everything we're doing is to maximize our PPE, our testing. And this is a dance, the hammer and the dance, as we know. This is the dance we're in of constantly trying to sort of use what we have to the best ability for Ohioans. And certainly the more testing we have, the better it will be for us going forward. Thank you.
Hi, this is Jeremy Pelzer, Cleveland.com. Governor, I've talked to a number of prison inmates about why the virus is spreading so rapidly through prisons. And one big thing they said was when they are tested, it can take days for those test results to come back. And in the meantime, they're just sent back to their cell block or their dorm, and they can infect other inmates. Do you see this as a problem? And if so, what can be done about this?
Yeah, I don't know if Dr. Acton can shed any light on that. I was not under the impression that it was taking this long. I will certainly find out, and I will report back tomorrow. Dr. Acton, do you have anything to add to that?
I'm sorry, sir. I don't have any, but we'll look into it, Jeremy.
Yeah, I mean, look, Ohio State has been very, very helpful. They've surged in there in helping us get the testing done. And I know the director is acting upon the testing, but I was not aware that that was taking that long period of time.
I would wonder too, sir, and we'll look into this for Jeremy, but I do wonder if you are a worker especially, or somebody, if you go to a private physician or something else. So we'll look into all of that and get that back for you, because I know that's where our numbers picked up all weekend, because they were turning them around so quickly. Thank you.
The reason you're seeing the numbers dramatically go up is because of the prison. So those numbers are going up, so the tests are being done, they're being recorded. So I know, those tests are being done, and that data is going into our database. So I would assume that that information is readily available to the prison.
Governor Scott Hallis, Xenia Daily Gazette and Media Midwest. Kind of want to piggyback on the question that was asked a couple minutes ago about daycare. As the economy opens and parents start to go to work a little bit more, there's kids that are still be home. At what point is it going to be okay for parents to take their kids maybe over to Mimi and Papa's or to Uncle Mike or whoever it would be if they need, to go to work, or if they need just 3 or 4 hours to do some work at home and, just need to have the kids watched for a while?
These are going to be individual decisions that people are going to have to make. I think that, if it was my family, I would be very concerned about taking those children over to the grandparents. I know in our family, we are not seeing our grandchildren. We have 4 who live down the road from us. We're seeing them from a distance. We'll walk over there, but we'll stay a good ways away. The other ones we're seeing, FaceTime, et cetera. So I think that, particularly with grandparents, the children certainly can get the COVID-19. They can have bad consequences, so we don't want to say that they can't. But by and large, they're going to do okay with it. But the problem is spreading that to the grandparents or to someone who has a medical condition. So this is kind of hard, because as Americans and as Ohioans, we are used to going in and doing something, and then we do it successfully and we move on. In dealing with COVID-19, that's just not the way it is. I mean, we have won a battle, we have done well, but it's still out there. And the vast majority of Ohioans are still susceptible to it. They have not had it. So the spread problem is just there just as much, today as it was a month ago, maybe even more. So that's the challenge. Those are all challenges, and those people are going to have to make calculations and make decisions. But what we're telling people is, continue to stay at home, continue to, keep that social distancing, continue to be very, very careful.
Hello, Governor DeWine. Todd Dykes with WLWT TV, NBC Cincinnati. Good to see you. For people watching at home or wherever they're viewing this news conference, they likely may not be aware that there are protesters outside the Capitol, the State House. The message from your vantage point, I know you've talked in the past that protesters have the right to gather and express their views, so long as they do it safely, of course. But I talked to a man from Marysville this afternoon, I did an interview in fact, and it's the first time he's ever protested, and his contention is that small businesses should have their own, just I gather businesses of all sizes, especially small businesses. Talked about a cousin who's on the brink of losing his business because of the restrictions, should have the right to, as adults, welcome commerce, and people should have the right to go in and engage in that commerce if they do it safely. You know, I know there's so many difficult components to that kind of question, and I understand we're all in this together, but there's a very real sentiment. I'm not sure how large it is, but it's out there. What do you say to those folks that are really feeling this pain, and we're seeing it again today here at the State House?
Well, that's a very good question. There's no doubt that small business is really being hit exceedingly hard. Our family has had small businesses for 100 years. We have a small business that has closed down, that there's nothing going on. And so I feel for everybody who is going through that. One of the things that we're working on now is to see, you know, which businesses we can start opening back up. We did this so that we would not be overrun in the healthcare system. So far, we have been successful. We did not want to see rationing of ventilators and other things that we saw in Italy. We did not want to see Americans go through that. We wanted to make sure every Ohioan who did get this had the best medical care that they could get and give the best shot at making it and coming out okay. So that's why, you know, this has been done. We are now in the process of trying to figure out, you know, how we can open back up, which businesses can open up, and to be able to assure the public that if they go to one of those businesses, at least all efforts have been made so that business can, in fact, open up. So these are difficult times. What we don't want to do, and I'll tell you what small business men and women have told me, and they've told me all the things that you just heard. But one of the things they've told me is, Mike, don't open back up. Don't have me come back out. And then a few weeks later, pull the rug out. He said, you know, they've told me, men and women, I can't do that again. So what we're trying to do in a very difficult situation when we're all going through this is to have businesses that can open back up, let them open back up, and not put us at risk of having the whole healthcare system overwhelmed and be in a position where we have to shut them down again. That is not the way we want. Businesses have told me if I go back in and open up and you close me again, I'm really am done. So we're trying to get it right, but we understand it's a very difficult situation for everyone out there, for the people who are unemployed, very difficult for the small businesses. They're trying to figure out, how can I hang on, how can I make it? I get it.
Return in the fall. What do you foresee as the future of social distancing in the classroom when the school bell rings and the hallways might be congested and kids getting on the school bus? And will they be required to wear masks?
All things that you know, I'm asking the schools to work on. Again, we have a local government system. We have local schools. We like our local schools. We like the local control. It's a combination of state control and local control, but ultimately many decisions are made locally. But these are things that we're going to have to work out between the Department of Education, our administration, bringing in the best experts that we can bring in, people who understand the environment in the sense of the environment that people are working in. We're going to bring them in from Ohio State and other universities to help the schools as they try to figure this out. So it's a work in progress, and you know, I wish I could signal to every parent out there that we know exactly what's going to happen in August when the kids go back to school, but we don't. We're working on it, and it's not just me. We got all the schools are working on it.
All right, thank you.
Hi, Governor. This is Molly Martinez with Spectrum News. I have a question about the protesters as well. Over the weekend, we saw over many state capitals. Here today, it was very difficult to get into the building safely while swimming upstream in a crowd of hundreds and hundreds of people. The people are chanting things like, freedom over safety. What do you say to them like their rights are being infringed on?
Say is freedom and safety. These are not mutually exclusive. The worst thing we could do is to completely take off all restraints, go back at it. We know what would happen. We know from history what would happen. We know from every expert who we can talk to, and that we would be back in a horrible, horrible mess. And some of those same protesters would have family members or themselves who might end up in a hospital, and we would not have the care that they needed. So we can do both. We can do both of these things. We can have freedom. We can have safety. We've got to do them in the order. We've got to focus on the safety, but at the same time, we are working right now to open more businesses, to move Ohio forward, and so we're trying to do both. But it is a balance, and I have full respect for the protesters. The only thing I would ask them to do is be safe. Stay away from each other. Don't get that close to each other. You're not helping yourself, and you're not helping anybody else that you might come in contact with. So they have every right to protest. We have 11.7 million people in the state of Ohio. I have no idea how many are up there today protesting, but they have every right to do that, and they will continue to do that. My job is to listen to the people of the state of Ohio, and to try to guide us with a lot of consultation and a lot of help to guide us in a pathway that gets us through this with losing as few people as we can, and at the same time try to put our economy back together. That's kind of the delicate balance that we're after, and that's what we're doing every single day. And you win the prize for the best mask, or at least the most colorful mask. Those of you on TV cannot see it, but it is a rainbow.
It's actually popsicles.
Right?
And
rainbow?
Thank you to my wonderful, industrious mother who's been like a sweatshop making these, so thanks to her. Thank you, Governor.
Thank you.
Okay.
Governor Noah Blindo with Hannah News Service. It seems to be that you're saying that school is going to be disrupted in some way in the coming year. Even if they do reopen, it will not be business as usual. So I'm wondering if you think schools should expect the same kind of latitude on testing and state report cards and things like that, or if they should be expecting to get back to normal in that regard next year.
I think we're going to have to see. Look, the most important thing is for kids to learn, and that's what we're going to focus on. We're going to focus on kids learning. We'll see where we go with testing. We kind of want to know where kids are. We want to help inform parents. But the most important thing is some of the things that I outlined. How do we make sure every child is getting the best education that they can and is safe? And those are the two things that we're focused on. I see our time is about up. Again, I apologize for the interruption for those of you on TV, and I'm sorry we had that. We have one more question, I guess. I thought I was wrapping, but I guess not. Go ahead.
Hi, Governor. Andrew Welsh-Huggins with the AP. Real quickly, we know we're going to see more positive cases because we're doing as much more testing as possible. We know the prison numbers are spiking, the number of cases. But how does that fit into the idea, especially with the president's plan, that before we begin any reopening, we want to see a downward trajectory of positive tests? For the average Ohioan, are we any place close to seeing total cases go down before May 1?
The opening that we're talking about is going to be a gradual opening. We're going to monitor it. We're going to be very careful. We want to do it right. And that's, we think it's consistent with what the president has laid out. The president made it very clear that every state's got to kind of do their own thing. And consistent with the broad overview as outlined by the president. We'll be consistent with that. but it will be an Ohio plan for Ohioans, which I think is what Ohioans want. Thank you all very much. We will see you back tomorrow at 2 o'clock, and we hope we have no interruptions and things go well tomorrow. Thank you all very much. Have a good day.
Governor Mike DeWine wrapping up from the Office of Public Safety, a different spot from which he was doing his press conference today. Brad Johansson alongside Darlene Hill at NBC4. Protesters again today, more protests. We had some audio in this first. Let's take you through some of the numbers first of all to see where we are today, to give you an idea. 12,919 cases. That's 1,300 more than we were at. 38 more deaths, 219 more hospitalizations right now since Friday, which is where we've been told to take a look at the numbers. Doesn't give you a whole lot of indication of more people, but we are up 14,000 tests at 91,000 from the 77,000 that we had on Friday. The big breaking story is that students are not going back to school this year.
Yeah, a lot of time spent talking about that today. Let's toss it on out to our colleague Adrian Robbins right now, who was there at the governor's news conference. She's going to break down the developments today. Adrian.
Well, Brad and Darlene, it's the announcement that many parents and teachers and students have been waiting for, but Ohio students will not be headed back to their school buildings, their K-12 school buildings, this year. The governor said he made that decision with multiple recommendations from teachers and superintendents who said there's just not enough time left in the year, and they think it would be better to keep some continuity for these students who have already gotten used to remote learning. The governor said at the same time the issues that originally closed schools remain here. The coronavirus is still very much among us, and students can still act as carriers. The governor said he's really thinking of not only the students' safety, but parents and teachers who can ultimately get the coronavirus from an asymptomatic child. Again, the same concerns that we had when schools originally closed. Now, the governor said, I know many seniors and seniors' parents are wondering, well, what about graduation? What about prom? Today, the governor said he's ultimately leaving those decisions up to the school district itself. He said large gatherings remain unsafe at this time, but he said as schools have become innovative on different kinds of learning and all kinds of things, they're going to have to become innovative now when it comes to making sure that these seniors feel like they were appreciated and have a little bit of a spotlight that they've worked so hard for over these past 4 years. Now, as for this fall, the governor said it is far too early to be making a decision on fall K-12 schools. He said one plan that they are thinking about doing is a blended learning, where they will do some in-person learning and some remote learning. But the governor said it's just far too early to be making those decisions. So what we know for now is for the rest of this school year, K-12 students will remain home with remote learning. Brad and Darlene.
All right, thank you so much. And while the governor talked about how it's up to each district to decide how they're going to handle what other activities, whether it's the prom, whether it's the senior banquet, whether it's, of course, honoring and congratulating the seniors while, of course, respecting the social distancing that is already, the guidelines already in place. He did also talk about what it's going to look like when some of these businesses start to open on May 1st, and hearing from some of the business owners, you got to get it right. If you don't get it right on May 1st and I'm going back in and you got to shut me back down, that's going to kill me. That's really going to could be the end of my business.
Well, and that's why I think we're going to be looking at a much more gradual reopening on May 1st in the state of Ohio than everybody anticipates. Doors are open, let's go back. If you have a number of businesses, especially restaurants, who need to create social distancing,
right,
prepare food safely, have workers prepare food safely, and deliver that food to people who would like to eat out, you're going to be asking the question, at what cost is it for me to go
Lieutenant Governor John Husted was not there today because he is meeting with private public sectors, talking about what this plan is going to look like. So many people breathing a sigh of relief here in Central Ohio, just by hearing the words, I don't have to worry about will the kids be going back to school, but they are going to be concerned about how those kids are going to be taken care of if they do go back to work.
Well,
because the governor has not rolled out his plan yet on what that is going to look like.
Adrian asked that question of the governor today as a question that was sent in to me by email. If I have to go back to work, and I have to go back to work on May 1st, what do I do with my kids? And the governor said today, I'm not ready to open daycares. And Dr. Acton says we're going to have to go slow, fast. I mean, we're just going to have to pace this thing. And I don't, here's the biggest problem that we've had throughout this entire, we don't know the answer to a lot of the questions.
Yes, yes. She emphasized, Dr. Amy Acton kept talking about how this is, we can't even predict something that's so unpredictable because it keeps changing. Because even when the governor was just asked about, well, the daycares are not open, what about dropping the kids off over at Mima's or taking them over to your grandparents' house for a couple of hours while you can go back to work? He's not recommending that because for the past 4 to 6 weeks here in Central Ohio, we've been told not to go to other people's houses.
We've seen a huge rise in the prison population because of the testing there, but she also mentioned that one institution, 70% of the tests that came back positive were asymptomatic. We have a guest that is going to join us in the 5 o'clock hour tonight who has just been tested and is completely asymptomatic while he's dealing with 5 kids and a wife at home.
We're going to talk to him live this evening at 5:30. We're also going to talk about the money. A lot of people talking about the small business loans that were, the money that was made available, the money that is no longer gone, and the Congress talking about putting more money out there. Are you going to be able to have access to that?
All of that starting with another special edition at the top of the hour at 4 o'clock. We appreciate you being with us. We'll see you in just a few minutes. Right now, we'll send you back to Ellen.